Hi, do you know actually what we do during hernia surgery? We don't excise or remove anything from the body, like we do in case of gallbladder surgery or appendix. In case of torn clot, we repair it, right? So as you know, hernia is protrusion of intra-abdominal contents through some weak spot in abdominal wall. So in hernia, the defect through which the abdominal contents protrude needs to be repaired. So we close the gap and place a mesh against it. So now, what is a mesh? Mesh is a sheet of inert synthetic material that helps in making the repair stronger, like using cement in constructing a wall. Tissue grows over the mesh and ultimately closes the gap completely. Now, so far as surgery is concerned, it can both be done laparoscopically and by open. Laparoscopic surgery is far better than the open surgery because cosmetically it is more acceptable, plus pain is less and return to normal activity is faster. Because of the widespread development in the field of laparoscopic and minimal access surgery, nowadays even complicated hernias can also be managed by laparoscopy by trained surgeons. So, when you think you are having hernia, visit your surgeon at the earliest because early repair is the best repair. Thank you. Take care.